We've got biologists and researchers from across the country attending the National Whitenose Syndrome Workshop in downtown Nashville.
Because bats are relatively unseen by most people, they don't realize how devastating Whitenose syndrome is. It is arguably one of the worst wildlife diseases in our recorded history.
It was discovered in 2007, but it wasn't until 2008 when the state agency, the New York DEC, really was able to determine that this was not just a localized freak mortality incident. In 2008, Whitenose syndrome was detected in western New England and in Pennsylvania, and that's when we really realized that, as quickly as it was spreading, that this was not just an isolated incident, that this was going to be a significant wildlife health issue.
Researchers in New York State started to notice that their small bat species, namely little brown myotis, had a white growth on their nose. They started taking photographs of it, and very shortly after, their bat colonies really started to collapse. The causative agent of Whitenose syndrome is this exotic fungus, likely from Europe or Asia, that depletes the bats during their hibernation. It's a cold-loving fungus, so it starts to actually feed upon the bat tissues. It irritates the bats, and then they go through multiple immunological responses, and ultimately they use up all of their fat reserves well before they can actually safely exit the caves and mines where they spend the winter. They can come out and the temperatures can be so low that they actually die of exposure. The other factor is that when they come out of hibernation, there's absolutely no food for them.
When it first came here to Tennessee, Whitenose syndrome, we started seeing similar declines, but they didn't happen as quick as they did in the Northeast. It was slow to happen in some parts of the state compared to other parts, so it was slow to see those declines, and kind of gave us a little bit of hope that maybe we had some bats that may hold on and survive this outbreak. We've since seen the declines to continue in areas, but we also see some stabilization in the numbers. The numbers haven't declined as quick or as fast as other places in the state.
One of the successes of the Whitenose syndrome response has been the collaborative nature that we have been able to foster across not just the research community, academics and folks from universities, but also state and federal agencies, non-government organizations, international organizations, conservation organizations, and that has proven to be really critical in addressing an issue like this, because there are obviously lots of challenges involved with responding to Whitenose syndrome, and lots of expertise and lots of regulatory aspects that no single group or small group can address.
We bring the disease experts and all those field people together, and hopefully it spawns new ideas and gets people connected to the point where we can really collaborate, because it's going to take that type of collaboration if we're going to be able to fight this disease. We have had breakthroughs. The difficulty is scaling those breakthroughs up to the point where it can be meaningful on a population level.
When it comes to cutting fungi, if you think about things like nail fungi or athlete's foot that people suffer with, these are very difficult cells or difficult organisms to eradicate. And so anybody who's had athlete's foot knows that it requires generally continued application of an antifungal product for weeks, sometimes even months. Now with Whitenose syndrome, the fungus, we call it PD for short, infects bats, and these are wild animals that have a wild distribution. They're not in cages, they're not in zoos. We cannot treat them on a regular basis, and so to try to treat individual wild animals is very difficult. And now that the fungus is in the environment, it exists in caves and mines off of bats and can actually survive just in the cave soils. And so what we're talking about, if we're trying to eradicate the fungus from the environment, is a huge problem, because we just are not able to isolate the fungus to target it with any kind of antifungals.
We have treatments that involve orange oil, mushroom alcohol, volatiles that are derived from fungi that live in Bolivian pineapples. We have all these compounds, but getting them to the place where they can safely treat bats and also not harm our natural environment is a huge challenge.
We have been referring to this as a national response because we were really trying to get state agencies and researchers and federal agencies involved well outside the extent of the known area where the fungus was affecting bats, because in a situation like this, the bats are spreading the fungus. We have the potential for people to spread the fungus in great distances, and we really wanted folks outside of the known distribution of the fungus to be prepared to create response plans, to do baseline monitoring for bat populations, to do surveillance, engage in surveillance for the fungal pathogen, and really be prepared for the imminent arrival of the fungus, whether actually that imminence means the next year or 10 years down the road. It's really important that people be aware that this is coming, that they collect information, they be vigilant, and they work with the public to try to reduce the potential for human-mediated spread or the arrival of the fungus in a state or in a province that wouldn't otherwise happen except for bat-to-bat transmission.
When it arrived, it was completely new, and we've really worked hard to try to figure out first what this fungus was, what it's actually doing to our bats, why our bats are behaving differently, why they're actually dying in the winter. We've come a long way, still have a long way to go.